And nothing ruins a good night's sleep faster than snoring. So are sleep apnea and snoring the same thing? We're getting to the bottom of this coming up. I love my breakfast. Okay, well, nothing ruins a good night's sleep faster than snoring. So either for you or your significant other, you might be tossing and turning. But does snoring mean that you have sleep apnea? Do you have to wear that big breathing machine to make it better? Could you stop snoring with a different pillow? Or maybe if you ate something different for dinner. These are all valid questions. And we know the girl with the answers. We have Dr. Patel with us to tell us more about our sleeping habits and how we can really get a good night's sleep. Doc, good morning to you.
Good morning. Thank you for having me on the show.
Well, we're up too early on weekends.
Yes,
obviously. So a lot of these people, we don't sleep. Right, Scott? So how can you help us get a better night's rest? What kind of things, first of all, what causes snoring?
Well, there are lots of factors that contribute to snoring. But basically, snoring happens when there's a narrowing in your airway that doesn't let you have enough flow of air going through, and the tissues in the back of your throat vibrate.
Okay.
And so that, enhances that sound that you hear.
Okay, and so that's what's doing it.
Yes.
And then we asked, is it the same thing? Does that mean that you have sleep apnea if you snore?
No, so sleep apnea is a whole different disorder. And that could be quite serious. Some of the serious symptoms of sleep apnea are stopping breathing when you're sleeping, not really feeling well rested throughout the day, frequent naps, if you end up having those. Those can sort of be symptoms, but that certainly needs to be evaluated by a physician.
Okay, you brought some do's and don'ts.
Yeah, so snoring basically is a symptom that can be treated.
Okay.
And so some of the things I recommend are, of course, decreasing weight.
Okay.
Treating your allergies, if you have allergies, because that can contribute. Decreasing alcohol intake, especially a couple hours before you sleep.
Okay.
Getting a better pillow, firmer pillow like this one here.
And then we should sleep in a certain position too, right?
Yes, so sleeping on your side versus your back certainly helps. And then, of course, the latest and greatest treatment we have is a laser treatment. It was developed by Photona.
And
it's called Nightlase. And it's basically a 20-minute procedure. It's something I do here in the Valley at my spa called SkinVolution Laser and Vein Center. It's a practice I share with my husband, Dr. Chandra Patel. He's a prominent vein surgeon here. So Nightlase involves about 20 minutes of your time. It takes 3 treatments. There's no pain involved. There's really, you can resume your activities after, doing it. And
what is it doing?
So basically, I'm using this wand to focus energy in the back of your throat for about 20 minutes. And what it does is it tightens and produces collagen, all the tissues back there in your throat that have become kind of lax and aged as you've gotten older. And so that no longer causes the obstruction in your airway, so the air flows and the snoring's gone.
Wow, and you've been very pleased with this.
Absolutely. I've had 80% success rate with my patients.
Awesome. So that's Nightlase. You're over at SkinVolution.
Yes.
And lay off the alcohol at night, take a couple pounds off. Those are probably both like New Year's resolutions.
Yes.
And then sleep on your side. I sleep on my back, so sleep on your side. All good advice. Thank you, Doctor, so much.
Thank you. Thank you for having me.
Have a good night's sleep tonight.